Creating a strong evaluation plan, assessing impact. This video will cover assessing the impact of a program. In other words, did the implementation have its desired effect? The first step to designing an impact evaluation is thinking about the questions that you want to answer. For example, you may want to know, does implementing a family-based program improve children's social behaviors? Or more specifically, does teaching parents to have consistent discipline improve their parenting practices and lower their child's conduct problems? These questions are the foundation of the impact evaluation. They should determine what you will assess from the program's participants as well as your analysis method. What is outcomes data? Outcomes data are the data gathered to answer the questions around the program's impact. They include both measures of the proximal or intermediate factors that the intervention is supposed to impact, and by impacting those proximal outcomes, we hope to have an effect on the target outcome. For example, in a parenting skills program, the proximal or intermediate factors might be parental efficacy and child monitoring. The target outcome would be the child's behavior. We would expect that by changing parents' efficacy and their monitoring, we will see an improvement in children's behavior. Thus, we would need to collect data on parenting practice, which is our proximal outcome, as well as the child's behavior, which is our targeted outcome. To effectively demonstrate change in an outcome, we need to show a baseline level, which should be assessed before the participants have gone through the program. And then they should be reassessed using the same measures after they have gone through the intervention. If one is done and not the other, there is no way to show change. We cannot say anything about improving the outcomes and thus cannot show the program's impact. Thus, it is essential that we use pre- and post measures that are the same at both assessment points. As a rule of thumb, pre- and post measures should assess outcomes that map onto the logic model as closely as possible. For example, if a chosen program is shown to decrease children's conduct problems, choosing a measure that only assesses academic achievement may result in one not demonstrating their desired effects. Taking pre- and post measurements requires having a plan for when data collection will take place. Participants should be informed of this, and the data collection plan should be developed prior to the implementation of the program. For programs supported by the Epicenter, pre- and post-tests are already established, and the Epicenter can offer guidance in administering them. For programs not supported by the Epicenter, we have a great database of previously used outcomes data tools for a host of evidence-based programs and practices that can help you in choosing what measures to use. To recap, impact evaluation measures whether or not there was change over time in the program's proximal and targeted outcomes.